8:26 right now. Let's talk about sex, baby. Coming up at 8:30, we're answering your questions when it comes to intimacy after menopause. And did you know men can actually go through the big change too? And
from the Fox 26 studios, this is Houston's Morning Show.
Well, after menopause, intimacy can become naturally boring for some women. It's a hot topic that can make your relationship go cold. Dr. Kanwal Bawa, host of the Dr. Sex Fairy podcast, joins us to talk more about it. Good morning to you.
Good morning.
Now, this is a miserable topic for a lot of people, and they don't want to discuss it. But let's face it, it's going to happen to every single woman at some point in life if they're lucky to live long enough, and some men as well. So when does this typically start happening to women where they might start experiencing some symptoms?
Every woman varies, but usually women start developing symptoms between the age of 45 and 55. Men can actually start losing testosterone as young as 30. And so for men, it's a more gradual decline, maybe 1 to 2% a year, whereas for women, it tends to be more abrupt later.
And for women, a lot of times they'll joke about just trying to strip off their clothes because of miserable hot flashes that are no laughing matter. But what are some other symptoms that women need to make sure they know may be coming soon?
You know, women come to my office in Florida all the time talking about this. They write into me on the podcast as well. They talk about how they are having difficulty orgasming. They talk about how they're losing interest in sex. I love my partner, Dr. Bawa, but I just don't seem to want him anymore. And things like that. They talk about how sex starts to hurt. So when all of these things are happening, you don't want to have sex.
And we want to try to help relationships and make women realize they're not alone in this, right? So it's not just in their mind, it all comes down to hormones?
Absolutely, because when hormones are fluctuating, your vaginal canal is going to be dry. It's going to lose collagen just like your face does. We're aging everywhere, unfortunately. And so the more you are aware of this, the more you can do something to fix it.
All right, let's talk about fixing it. What can you do to help intimacy in your relationships?
Oh my goodness, I could make a vagina sing Drake or Beethoven with the treatments I can do now. For instance, from a CO2 laser to radio frequency, even radio frequency microneedling, to PRP therapies, exosomes. There's a lot that a lady can do now to bring her vagina back to perhaps a pre-childbirth state.
And I don't think that a lot of people realize that rejuvenation is possible. Now, it seems awfully embarrassing, but I'm sure that as a professional, you're used to that, and you just need to think of it as going to your OBGYN.
100%. And it's sad how few women will talk about it. Even in my office, they don't always tell me the depth of their suffering. I had a patient of mine, she had a lovely result with her treatments, and I invited her on the podcast. And at that point, she said to me, Dr. Bawa, when I came to you, I felt like something inside me had died. Now I feel that I can live again.
Oh my goodness.
And it's heartbreaking that women feel that way.
It's almost like taking 20 years off of them, it sounds like, by doing something so simple.
Yes.
Now, what about men? Let's bring them into this conversation, because certainly hormone levels fluctuate and change for everybody. And testosterone starts to go, as well as estrogen and progesterone for women. So what are their symptoms like? And do they really have male menopause, so to speak?
You know, it's called andropause. There's some controversy about how much it affects men. But the fact is, testosterone does decline with age. Also, men and women are developing blockages in their blood vessels as they age. What that's doing is keeping good, healthy, oxygenated blood from invigorating your tissue. And that makes a difference. Men are having a difficult time getting and maintaining erections. So it's a very real problem.
Well, how can people find out more from you?
They can go to my website, drsexfairy.com, and of course check out the Dr. Sex Fairy podcast for more.
We'll get that link on our website, fox26houston.com. Thanks for being here.
Thank you.
Nice to talk to you.